I'm Arun Singh. I'm at the Cleveland Clinic. I'm a professor of ophthalmology and I'm the director of ophthalmic oncology at the Cola Institute. Well, it's many years ago when I was a medical student. I just felt the need to work with something small, very clean, something that had a bright future area for research, and ophthalmology seemed to be the natural fit for that. So that's the reason. I was born in England, but I grew up in India and did my medical school in India and did my ophthalmology in New Delhi. And then in those days, I was trying to become fellow of the Royal College, so I decided to come to England to study. And I did that. My last position was at St. Bart's Hospital, and I worked with Mr. John Hungerford as his registrar. That exposed me to oncology, and I just then, from then on, just wanted to work in this area and came over to the US, and I've been here about 20 years and I never left. So over the last 8 years at the Cleveland Clinic, we have built up a big department of patients with eye tumors, particularly, and there are many other patients with retinal diseases and other kinds of disorders. And with Brandy, who is an expert ultrasonographer, we have built up a tremendous experience, and we wanted to put it all together into a book that's easy to read and comprehend, and has some DVDs so one can easily learn how to do an ultrasound and also do the interpretation. So that's our new book. It's Ophthalmic Ultrasonography. So now, like everything else, all the images are stored digitally, so easy to retrieve them. Also, the resolution is higher. We have bigger screens, so we can see greater details. And also, we have, for the last 10-15 years, high resolution scans for the anterior segment, and also even ultra high resolution scans for cornea. And all of this has been highlighted in the different chapters within this book. We do read print books, and I think that's as a base for knowledge. I think it's good to read a standard textbook, and then anything extra that you need, you can go online and search for new content or recent updates. But as a basic knowledge, I think it's good to still read books cover to cover for a comprehensive knowledge. Yeah. So the book is for practitioners, ophthalmologists and academics, and also for residents, because we cover refractive surgery, we cover biometry, that every ophthalmologist needs to know about biometry, because you're going to do cataract surgery, you need to be able to calculate the intraocular lens power implants, intraocular lens powers. It's also useful for patients with trauma, retinal disorders, uveitis, pediatric ophthalmology, tumors, you name it. It's for all sub-specialties in ophthalmology, so it's for every ophthalmologist. Yeah. Well, Elsevier is obviously the largest publisher, I guess, in medical textbooks, definitely in ophthalmology. And they have my previous books I have also published with Elsevier, and they're very supportive in creating the design, the format, and the layout seems to be very catchy, easy to read, easy to comprehend. And I had a very positive experience over the years, so therefore I continue to work with Elsevier for the new book.